Welcome to the training on the Recency and Repeat Tester Survey. We will be explaining to you how we complete the study documents and what all the information is that we need for the study. Who are we enrolling in the study? Well, as we know, South Africa has one of the largest HIV epidemics in the world and is still impacted by high incidence of HIV infection every year. This is why research is needed to understand the different components of the epidemic, to find ways to address them and improve public health policy and interventions. This survey is specifically focusing on HIV recency testing, as well as looking at who are repeat testers visiting your clinics. So what is a recent infection? This would be a client who is classified as having a recent infection, and that is if they have been newly diagnosed with HIV within the previous 6 months, have initiated ART in the past 14 days, and have no history of prior CD4 count or viral load testing, which we confirm using LabTrack. And this is to screen for those who have been previously in care. The other group that we are looking at are what we call repeat tested. A client is classified as being a repeat tester if they have been diagnosed with HIV for more than 6 months, they initiated ART more than 14 days ago, and they have a history of prior CD4 cell counts or viral load testing, which we confirm via LabTrack. This also includes clients who have defaulted and are returning to treatment, but they also may not have started treatment already. The study focuses on clients that are accessing HIV testing services at your site as part of entering into care. This means we do not include clients that are already in the care cascade and are today visiting your clinic as part of their ongoing treatment. So only those who are accessing HTS services. So what do you need to enroll clients in the study? Well, we have provided you each site with study kits, which have different components that give you everything that you need to include the clients. So we have the survey forms, which is a 1 page for each person, and at the top right hand corner of the survey form you will see a barcode and the site name. This should be the site that you are at. We also have an information sheet which we provide to the client, so that means you give it to them and they can keep it and take home with them. And this is information about the study. We also provide you with training aids on how to complete the forms and conduct the study. The other paperwork that is included is an enrollment log. This is a log that you keep on site. This is bound either with a binder or with staples. There are also then 2 packs of tracking logs. These are different tracking logs. One is a specimen tracking log. The other one is a LabTrack log, which we'll discuss later. We then also provided you with supplies to take the samples. So this includes phlebotomy needles, alcohol swabs, the special tube specific for the study, which is called a PPT tube. This is like an EDTA tube, but you'll notice that it's got a gel plug that helps when we do centrifugation. We also provide you with specimen bags to put the specimen in. There is a roll of specimen barcodes, and we'll discuss how we use these, but these essentially are going to link your sample to the form, and it's very important that these match and that you use these appropriately. There's also what we call the green label or the shipping label, and this is to tell the couriers which lab the sample needs to go to, and we provide you with courier bags to put all your different specimen bags in to keep everything together. You will also use this to put your logs in that go with your samples. So the survey steps, depending on the size and design of your clinic, may be split between different healthcare workers. This could be counselors, nurses, clinicians, whoever is following the client to begin with. And then of course the blood will specifically be taken by someone who is trained in phlebotomy, so this may be a nurse. So we start off by screening the client for eligibility. We introduce the survey to the eligible client and invite them to take part. Provide and explain the information sheet regarding the survey. This is all the information so they know what the survey is about. We obtain informed consent to be part of the survey. That means that they are agreeing to be part of the survey out of their own free will. We then conduct the survey itself, which is an interview, and the participants, we complete the form for them. That's just that one-page survey form. After that, the client will then proceed to bloods, and we will take that specimen in that special PPT tube. This will be packaged, and then also make sure that you complete the lab track log and the sample shipping log. Those are those two logs we told you about. And of course complete the enrollment log, which remains on site. Then the samples are shipped to our central laboratory at the NHLS in KZN, and from here they'll be shipped to the NICD in Johannesburg. So who is eligible to take part in the study? So we're not just talking about our specific study population as we describe the recency and repeat testers, but we also need to make sure that they are of the right age to take part. So everyone needs to be at least 18 years old in order to be giving their own consent. They will also need to have a reactive HIV result. So if they're recently diagnosed, that's a newish result. Whereas if they're a repeat tester, this is someone who is re-entering into care or already knows the results, but today are starting their care journey. And they've got to be giving their informed consent, so this must be done willingly, to take part in the procedures. Anyone who is not eligible or is ineligible, or anyone who is younger than 18 years of age, has a non-reactive HIV result, and those who do not give their consent to take part. So what is informed consent? The research protocol has been reviewed and approved by a Research Ethics Review Committee at the University of Witwatersrand, or WITS, and it is being conducted in agreement with the regulations and guidelines that we have. So this includes Declaration of Helsinki, ICH GCP, Ethics in Health Research, and the South African GCP. And complying with the agreed regulations and guidelines for research ethics means that the research participants are not being harmed, so neither them nor their family members will be affected by the study. They have their rights protected, and this is put before the needs of science, and they do not have their right to choose taken away from them. So remember, they've got to take part voluntarily. Informed consent protects the participants' rights by ensuring that they are aware of every step of the process and that they are being asked to participate freely and completely voluntarily. So therefore, the participants should be made fully aware that they can withdraw at any point during the study procedures, and there won't be any reprisal for them. The information sheet, which is provided in your kit, provides an introduction. This gives an overview of the study, what tests will be done, and a high-level overview. Why are we asking you to participate? This explains the eligibility criteria. The next section is what will happen during the surveillance procedures. So it gives more details about the interview questions as well as accessing medical records. So of course that's a lab track, and that a blood sample will be taken and which tests will be done. There's a section on voluntary participation explaining that it is the client's free will to take part and they don't have to if they do not want to. There's a section explaining potential harm. So as we are taking blood, we of course know that there may be some discomfort and they might feel a bit dizzy. So it's important to explain that to them. From a standpoint of potential benefits, of course, we are advancing science and also for the client to know their status. But of course, we will use this information to improve services in South Africa. Confidentiality explains that the information will be kept confidential and anonymous. Further information gives contact details for the research team, so should they have any questions afterwards, who they can reach out to. And of course, for further information, we also provide details about the ethics committee. So as I mentioned, the survey form is a one-page form that you've been provided in the kit. So it's really 1.5 pages of information that we collect. Quite a big section of this is actually just regarding the consent. So after you provide the information, the participant has to sign that they understand the information, they want to take part freely. We'll go through each details. So the facility details are pre-printed on the survey form. That's on the top right-hand corner of the front page. This barcode that is there is for us to use in the lab to scan. So please don't place any other barcodes over it or any stickers to cover that barcodes, because then we can't scan it. And also make sure that the details are correct for your facility. So it mustn't say another facility name on it. It must make sure that it is your facility name. Section A is the pre-enrollment questions. So we collect this from everyone, even people who refuse to take part. And this is one of the most important sections because this will help us determine which category the client falls into. So either a recent infection or a repeat tester. It starts off with the biological sex, the date of birth, so we can determine age, the race of the participant, and then questions A4, A5, and A6 are very vital. We need to know if this is a first test ever, what was the result from their most recent result, and then the date of the most recent result. So dates are given in numerical values. So this would be the day of the month, then the month as a number, and then the year. We've pre-printed some of these where it says 2025 because of course this year is 2025. So as I've mentioned, section A is absolutely critical. If we do not have this completed correctly, we can't classify the participant and therefore we cannot do all of the study procedures. So let's look at these questions a bit closer. So A4 asks if this is the first test that the client is ever having. This means ever in their lifetime. So it doesn't mean the first test for today or the first test at your clinic. It means the first test that they've ever had for HIV. The next question, A5, asks what was the result of the most recent. So not today's result, but the most recent test that they've had before they came to the clinic today. If you have answered yes for this is the first test ever, then for A5 you'll see there was no previous test. This has to make sense. If they had a reactive result before today, it's important to record that. However, if they've had a previous test and it was non-reactive, it is important for us to know. The date for A6 must be before today's date, because if we are asking about a previous test, that means it isn't the test done today. So please do not complete this section for today's test. There is a different section for that. Section B is regarding consent to participate. This is where we note whether the person agrees to participate or refuses to participate. So even if someone is refusing to participate, we are still going to fill in this section of the form so that we have a record. And these forms will still go with the lab because we must record who is refusing to participate. So it's very important to indicate what their response is. So for B1, if they agree to participate, you must put an X in that box. However, if they refuse to participate, you must put the X in that box. Make sure you note the position of the box because sometimes people get confused and the participant agrees to participate, but they fill in the box on the right. And then we read that as refuse to participate. So make sure you are putting the X in the correct box. The participant must then sign the form. If there's no signature, we do not know that they did so voluntarily, and we have to exclude the participant. So please, even if the participant can't read or write, they must at least put an X in the box, but there must be some sort of mark indicating that they were part of this process and they agreed to participate. Then please note the date, and it should be the day of the visit. There is a section for a witness, and this is only for people who are not able to read or write. Perhaps they forgot their glasses that day, perhaps they have literacy issues, perhaps they have a medical condition that stops them from being able to read. So then they need a witness present, but it's not for everyone. It's only those people who are not able to read the information sheet themselves. Then you would invite a witness to take part in the process. They will then be present for the information sheet, and they will acknowledge that they have understood the information and the correct information was given to the participant. So if there is a witness, please ask them to also sign in the block as well as put the date. But remember, even if the person is not able to read or write, in the participant's signature box in B1, they still need to make a mark. If the participant refuses to participate, and only if they refuse, then we complete section B3 to indicate why they refused. And lastly, for B4, the healthcare worker, whether that's a lay counselor, a nurse, and even if it's the same nurse who's going to take the blood, they need to put their name in the block as well as sign and put the date. Please make sure that all three dates, if all three dates are recorded, they must match, but at least if it's a participant and only the healthcare worker, both those dates must match. So remember, consent response is mandatory. If we don't know whether they've agreed or refused, we have to note that it was a rejection. Make sure that you are always encouraging the participant to sign in the block, because if there isn't a signature, we reject the enrollment. So even if you fill in the form and provide a blood sample, if there is no signature there, we have to exclude this participant from the study. And remember, a witness is only required when the client cannot read or write. And the nurse cannot be the witness, it has to be an impartial third-party person. So let's review where we have reached. Well, we've gone through the informed consent process. If they've agreed to participate, that box is indicated correctly. If there was a witness, the witness has signed, and of course the participant has also signed, even if they can't read or write. And the HCS counsellor or healthcare worker has also put their name and signed the form. If the person has refused to participate, this has been indicated on the form correctly and the participant has signed. The counsellor or nurse has also put their name and signed. And this is where we stop for these participants, because if they don't want to be in the study, we do not go forward. But what is very important is that we send the form with the samples in the courier bag to the lab. So remember, we said in the kit there is a courier bag, and in the courier bag we will be putting the samples of the clients who agree to participate, but we will also send the forms of those who refuse to participate. If the client has agreed to participate, we will then go on to section C, which is the demographic and clinical information. Here we will note their highest degree, the education level that they've completed. We will note the marital status as well as the pregnancy status. If the participant is a male, of course, we do not expect that they might be pregnant, so please indicate that they are male. Section C4 asks about whether the client has initiated ART already. So it's important to note, have they initiated in the last 14 days, initiated more than 14 days ago? And remember, this is important for us to know, because if they initiated in the last 14 days, they will still be included in the recency arm. However, if they initiated more than 14 days ago, they then classified as a repeat tester. If today is the first time the person knows that they have got HIV, they would not have taken ART yet. So then we can say, no, the client has not taken ART at diagnosis. If the client is currently taking ART, please note the facility name in C5 where they started that ART. And then lastly, note if ask them if they have any genital discharge or ulcers, as well as whether their partner has been treated for an STI in the last 8 weeks. We are expecting that you have included people who are accessing HIV testing services today. So section D is where we respond to their current HTS outcome. So that means the test that they are having done today. This must be completed for all the participants, and it's a result of today's test. So remember, do not put the results of today's test in section A. That is the history. Section D is the current. It is today's test results. So we'll note whether they are reactive or non-reactive. Of course, for inclusion, they should be reactive. The date of the test, which should be today's date, and it should be the day that aligns with their enrollment. So whatever date they've signed for their consent must correlate with today's HIV test. And also we must note if they're proceeding to baseline bloods, because we are only meant to be taking the blood if they are having bloods already taken that day. So if the client is reactive and indicates yes, they are going for bloods today, you take them through for the bloods. However, if the participant has a reactive result and perhaps cannot stay for bloods or needs time to process, please indicate no, because then we know that there won't be a sample coming with that participant. So please make sure you say no there. And then if you won't be taking a blood sample, that form must still go with the other samples that are collected for other participants. So like the refusals, that form will then be included in the courier bag. So let's review where we are. We have 3 categories of participants. We have those who are refusals. That means they've completed section A, the screening questions, as well as section B, the consent questions. Those forms must go to the lab. The second category is that they have agreed to participate. They've had a reactive results, but they for some reason will not be proceeding to bloods today. So please make sure the front of the form is completed. That is section A, the screening questions, section B, the consent, section C, demographics and clinical information, and section D, the HTS outcomes. This form must still go to the lab, so please make sure it is given to the person who's taking the bloods from the other clients so that all the samples can be kept together. And then lastly, the main category is those who are agreed to participate, they have a reactive results, and they are taking bloods that day. So they will also be completing the front of the form. So the section A, the screening questions, section B, consent, section C, demographics and clinical information, and section D, the HTS outcome. You will then escort them to the nurse. Of course, if you are the person who did the screening and the testing and will now be taking the blood, of course, they don't need to go anywhere else. So again, remember, it is important to make sure that section D was completed for today's information. Once the person has now been going through to the nurse, they've got the reactive results, and they will now be proceeding to bloods. This is also the point at which we need to do the lab track verification. So remember, this is very important for us to know. Are they part of the recency cohort? So they've got no lab track results, versus they are a retester. So they've already been part of the care cascade at some point, and they've already had a CD4 count or viral load count. So it's very important to complete the section so that we can know which category they're going to be in. So for E1, we need to know, were you able to access lab track at the facility? If you were, then E2, did you find any results or were there no results? Section E3 and 4 are regarding CD4 results. If there are results, we need to know the date of the result and which of the categories it fit in. And then section E5 and 6 is related to viral load. Please make all efforts to verify the testing results so that we can know which category that person fits into. But as a backup for this, we also require that you complete the lab track log. This is for our team in Joburg to go and verify those results in lab track and just to make sure there is alignment. So this is critical information. As I mentioned, this is so that we know which category each person fits into. So on the lab track log, which was provided in the kit, this is not to be mistaken with the specimen tracking log. You will see the lab track log is different because it has columns for the name and surname of the person. This is for us to do the search on lab track, as well as their sex and their date of birth. We need multiple identifiers to ensure that we found the correct person. And then of course we need you to put one of the barcodes, the participant study number, which is the barcode that is provided in the pack. You must put these on the logs so that we know that that form links to this person on the log. And make sure that the logs go with to the lab. So it's only the enrollment log that will stay on site. The lab track verification log itself will be going with the samples. So once you've recorded the lab track information, both on the form as well as the log, a sample will then be taken. This is where we place the participant barcode. There's a strip of barcode, so it's provided in the kit, and this is where you will be placing those barcodes. So not on the front, not anywhere else, just in the box that says participant barcode. It is important for whoever takes the sample to also note the date. And then there's a section F5 that says receipt date. That is for the NICD to fill in. So you do not need to write anything there. Once the sample is received in the lab, they'll make a note there. But for F6, it's important to note who collected the specimen. And as I've mentioned before, you may be the same person who does the HTS testing and who has completed your name on the front of the form. But if you're also the person who's taking the blood sample, it is important to re-record your name here so that we know, because we capture all this information and it's very important. So please make sure that the name is written there. There's one more box that says episode number. This is for the lab. Please don't put any more stickers here. There's only one place you're going to put a sticker on the form, and that's the one that says participant barcode. So let's recap where we are with completing the form. So make sure to complete both sides of the form, and very important to complete the consent section, whether someone agrees to participate or refuses to participate. If we don't have this section, unfortunately we cannot include any of the information, so it's important that this is completed correctly. Make sure that we're able to read your writing legibly for your names, but also that a nice neat box X is placed in each box so that we know what the answers are. Very important to complete the baseline questions for everyone. So even those people who refuse to participate, we still complete section A. And then again, just a reminder that consent must be clearly indicated. Some tips about taking the sample itself. Remember, this is a separate blood tube to the one that is being taken for routine bloods, and that is using the special tube that we provided in the kit. It's an 8.5 ml PPT tube. PPT stands for plasma preparation tube. As I mentioned, it is like an EDTA tube, but it has the gel plug. Make sure that you fill the tube with as much blood as possible. And of course, once you've taken the blood, you must mix it well to prevent the hemolysis. This allows all the additives that's on the tube to mix nicely into the blood. Remember that we provided you with barcodes, and it's very important to put a barcode sticker on the label, on the tube itself. If there's no barcode on the tube, unfortunately, we have to discard the tube because we don't know who it came from. So the barcodes link the tube to the form that you are going to send with. So please remember, place a barcode on the tube as well as the form so we know the two are linked. We've provided you with specimen bags to place the sample into. The specimen bag has an inner pouch and an outer pouch. The blood tube goes in the inner pouch where it has the double ziplock. And then of course there's the outer pouch where you'll fold up the survey form and you'll put that in the outer pouch. Remember, we don't put the forms inside the inner pouch in case the blood sample leaks, and then we'll have blood all over the form. So that's why we use the outer pouch for the form. We must make sure that we place the green barcode, the green shipping label on the outside of the pouch. And this is if the sample gets separated somehow and falls out in the courier bag, then the courier will know that he must put it back and take it through to the correct lab. And then lastly, remember that the courier, whenever the couriers come, you must make sure that you are sending the samples so that they get to the lab as quickly as possible. So let's look at labeling of the sample. So as we've mentioned, we provide you with barcodes. There are 10 barcodes per participant. So This is designed that each participant has their own barcode. The first barcode will go on the PPT tube and the second on the data collection form. This, remember, links the two together. When you place the sample, the barcode on the sample itself, please make sure it is lengthwise and not wrapped around. The reason is because we use a scanner to scan the tube, so if it is lengthwise, the scanner can read the whole barcode. However, if it's wrapped around the tube, then unfortunately the scanner can't read around the curve, so we'd have to then manually capture the information, which then makes it take longer in the lab. The third barcode will be going on the enrollment log. This is the log that stays on site for you to keep a record of who you've enrolled. Then, as mentioned, the lab track log. It's very important that we know which participants' details you are completing on the lab track log. So when we have our data captures do the search in Joburg, we can then link it back to your sample. And then, of course, the specimen tracking log. This is a record of all the specimens that have been collected. And just a reminder of the sample time frames. We must make sure that samples are shipped daily to the NHLS laboratory. And this will ensure that the sample integrity is maintained, especially if you have a very remote clinic and you know the samples won't be collected until a much later time. So, example, on a Friday, you know the courier is not coming again until Monday, then it's best to not collect any more samples for the day and rather wait for a day when you know the courier is coming. However, if you've collected sample and the courier is not coming that day, it is okay to keep the samples in a fridge overnight. So remember, a fridge is 2 to 8 degrees. It's not freezing, and it's important not to let the samples freeze. This can be the same fridge as diagnostic samples. So if you're already doing this for diagnostic samples, you can keep the samples in the same fridge. And just a reminder to try and not keep samples over the weekend. So if you know the courier is not coming again until Monday, it's better to not enroll any more people that day. Let's have a closer look at the tracking logs. So the enrollment log, this is the log that remains on site. This is the one that either has a spiral bind or it's been stapled together. And this is for your facility so that you keep a track on site who you've enrolled. And this has a study name pre-printed on it. Your facility name is also on the cover. Then within the log, we'll be recording the participant study number, and that's that barcode, the date that they were enrolled, as well as the staff initials of the person who enrolled them. And you will keep this on site until we tell you that you can either destroy it or we will retrieve them and keep them at the lab. So this is what the log looks like. As I've mentioned, it's got the study name on it. The facility is actually already printed on the cover of your forms. And here we will put one of those barcodes from that strip of stickers, the date enrolled, and the staff initials. The lab track log, we keep mentioning this one. It is absolutely vital that you do complete it and send it to the lab. So this will be, we will make sure that this is completed for all the participants and that this will have the study name, the studies already printed on there. So the study name is printed on those forms already for you. We've looked, there's a participant study number, the barcode. This is also where we need to complete the participant's full name, and that's for us to find them on LabTrack. Important to have other identifiers such as their sex and their date of birth, so we can ensure the name we do find is the same person as who's had the sample taken. So you can complete one log for the whole day. So there's enough spaces that you can have more than one person there. So for example, if you see 3 or 5 clients in the day and they all take part, you can keep completing that log for each person. And then when the shipment is ready to go, you can put that log with those samples in the courier bag and send to the lab. So please remember that this log must go with the samples and it must be completed for each participant. So as you can see, this is what it looks like. We've got the enrollment date, so that's the day that you are taking the blood sample, the participant study number, which is the barcode, their name and surname, their sex, and the date of birth. If you have more than one page, it's important to complete that there are going to be multiple pages, and there's a place for this at the bottom of the page. The specimen tracking log is a bit similar, except we do not collect their names. This is to track the samples that are sent. So again, you can use the same log for multiple participants for the day. This is also placed within the courier bag, and it goes with the samples to the lab. So very similar to the other logs, we have the enrollment date, the participant study number, the barcode, the date it is shipped, and when it reaches the lab, we will then note the date it was received and if there are any comments. For example, if it's missing one of the lab track logs, or if the samples are not labeled with a barcode, or if the consent was not ticked, we'll note this on the log. So it's important for you to complete the first section and send with the samples. So let's recap what goes to the lab. So remember, we've got the refusal category. This is where it's just the first parts of the form that are completed. This participant will not have a barcode because the barcode's role is to link the sample to the form and the different logs. So you will still send the form to the lab. It will just go as a loose document in the courier bag. Similarly, for those who agree to participate and have a reactive result but they don't proceed to bloods, we will also complete that form. And there's no barcode because there's no blood sample, and those forms must go with to the lab. Then we have the full study package, which is someone who's reactive, they agree to participate, and they have blood taken. You must complete all sections for them. You must link their blood sample with the barcode to the form, and using that same barcode, complete the lab track log and the specimen log, and also note for yourself the enrollment log, but the enrollment log stays on site. And then what gets sent to the lab? The completed survey form, which is in the outer pouch of the specimen bags. We have a blood sample with the barcode that links it to the completed form. Also make sure you've completed a lab track log for that participant and a specimen tracking log for that participant. So remember, courier to the lab within 24 hours of collecting the sample, or whenever the next courier is going to be. If you do need to keep it overnight, it must be in the fridge. And we use the routine courier service to send through to the lab. Thank you so much for listening to this information. If you would like to reach out to us, we have a hotline. You can scan this barcode, the QR code, or you can just send a WhatsApp to the number, and we will answer any questions that you might have.